Quality is more important than anything. As far as this organisation is concerned, quality embraces the three aspects of patient safety, clinical effectiveness and patient experience. And to show how important it is to the board, we put quality at the top of every board agenda meeting.
For a board to look at complaints does give it a degree of understanding about the experience that patients actually have. It allows it to understand the individual experience, but if you weigh that up against experiences that you have throughout the year, then you can start to see whether certain departments are performing as you wish them to, or individual consultants, and it gives you an overview of how your hospital is performing in total, but also in terms of its individual departments.
As a board, we try to be as open and visible as possible. We do that in several ways. Firstly, in a formal way, we invite teams and clinicians to present at various meetings. But for me, more importantly, we're quite open and visible in an informal way.
The board were aware that we had a certain number of complaints coming from patients and their families about delays in admission for operating procedures.
We also had heard from the nursing staff on the ward that it was quite a difficult process to get the patients admitted and discharged at the same time in the morning. And also our anaesthetists had raised some concerns around patient safety, because they're supposed to consent the patients and give them detailed information before the operation. So from all those points of view, we were getting information that that admission process was not as we would want it to be.
You often walked onto Cherry Ward, there were patients sitting in little chair areas. It wasn't very pleasant for them because they were very, very anxious about their surgery. We had nowhere for these patients to get them prepared. They felt very anxious, very frightened. There wasn't anywhere private for the consultants to go and speak to the patients. And we often used the sister's office to actually take their consent.
There was unhappiness amongst the anaesthetists and the surgeons because they couldn't see the patients in a suitable environment, and that invariably had an impact on the start of the operating list, because unless they're seen by the appropriate people, the operating list can't kick off. So it was a rollover effect, essentially.
The cost is massive, it's big. Basically, 1 minute of theatre time, it costs roughly about £25. So if the theatre session is not starting on time, so every minute, from my point of view, the trust is losing £25.
We've voiced our concerns to the board on more than one occasion, mostly on an unofficial basis. We have various meetings where we meet the senior members of management, and they understood that there was an issue there that needed to be sorted out.
The discussion went forward is that we want to provide somewhere a better system to be able to admit a patient. So the decision been made from the staff and myself for a surgical assessment unit.
A board needs to ask whether the project has benefits for the patient in terms of safety or clinical outcome and effectiveness. It also has to ask itself whether there is a business case to achieve and efficiencies to gain from the project.
We went and had a walk around some of the locations of the admissions lounge and tried to think through how the patient might experience that journey from the admissions lounge to the theatre itself.
For various reasons, we ended up with the space that we have at the moment. Patients don't have to walk very far to get to the operating theatre, which we thought was very important, because that minimises the transit time. It's an area that people know well, and it's an area that we felt would cause a minimal disruption to the rest of the hospital working if we were to take it over.
The board's happy to listen to any ideas from clinicians and others who work here to improve the efficiency or the effectiveness of the hospital. In particular, the board is very aware of the need to continually monitor quality in terms of patient safety, clinical outcome and the experience of patients. So in this instance, the surgical admissions lounge was very key to addressing all those issues.
I think what the board did was bring together potentially a number of disparate parties that were going to be involved in this change, and tried to look at the whole to see the fact that we were doing this change for a good reason. That might not have been possible if each department had have just remained in its silo and not seen some of that bigger picture.
It was a fairly simple business case to identify an area that was used for non-clinical activities, and in this instance HR, and to talk to the incumbents of that particular wing to change its use for patients and to move the administrative staff to an area outside the building.
The impact on staff has been, a very positive one. We have done a survey that showed that lists are much more prompt, starting on time. I know that both my surgical and anaesthetic colleagues are a lot happier. They're able to see patients in an appropriate environment. They're able to see patients in private. The patient's dignity is respected at all times. They have a clinical room available if they want to examine the patient or have some specific blood test done on the day. And the whole thing is a much smoother exercise right from the beginning.
For me, the crucial one was that we spent just too much time thinking through the options and almost looking at every way of doing it. What we learnt was that just sometimes you have to make that decision, even if it's not perfect.
Looking back, I should have recruited the staff much earlier to SAL to start the process off.
What I had to do is to think about the short window and how am I going to do it. So I had to take various nurses who had the required skill to pass them on to surgical admission launch in order to get this target. In hindsight, if I had the time, it probably would have ran a little bit smoother.
When South was first opened, I feel we did it an injustice. We should have advertised it a lot better than what we did.
I think what's important is that it wasn't a board project. It came from staff who were at the sharp end, who understood what the issues were and put together a case to improve the situation. It's important to listen.
The environment is quieter, it's calmer, it's private, and you can see that for yourself. But at the same time, we've also surveyed the patients to see whether they feel that the experience is better from their point of view. And we've just had the first feedback given to us, and it's across the board much better. People feel it's a clean environment, it's quiet, it's calm, and generally speaking, those patients who've had an operation here before think it's a much better process.
I can see the benefits because I've actually experienced what used to happen on the wards, and it was a little bit hectic up there, and to have it more organised, it's much smoother process for the patient and the doctors. Everyone benefits really.
From this hospital point of view, it's great because what happened with that is that we are more efficient. We got doing more patients through the system. We provide a good quality of care. We can be much more become a hospital of choice where patients will want to come to us for operation.
What the board would expect, as with any business case, is that there will be a re-evaluation, a reappraisal of the business case after a period of time, 6 months in this case, just to make sure that the benefits that the business case identified are being achieved.
I think that really this has shown that there is a way of taking a complaints process, for example, and turn that into a positive, so that you're not just solving the individual patient's complaint and saying I'm sorry, you're actually solving it for the patients that follow them. And I think that's a really positive thing.